Hey, we're back. This is live from HMPS 2026. We're in Salt Lake City, and I'm sitting down with a good friend, someone I've known for a number of years now, and I've considered you a good friend as well as a colleague. That's Chris Woolsey. Chris, thanks for showing up today, having a conversation.
Sure.
Well, before we jump in, share a little bit about yourself, your background for everybody listening in.
Thanks, Chris. No, it's great to be here and talk with you. I have been in healthcare for, too many decades now, going on 3 decades, but I started my career as a healthcare reporter in Chicago and covered healthcare policy, covered the business of healthcare. I didn't really do consumer reporting, it was for a business audience. And then, everything shifted with the internet, so journalism changed quite a bit. It was a disrupted industry. So I leaped at the right time and went into global public relations with an agency and primarily did media training, but then when they found out about my healthcare background, I started consulting with healthcare systems and other clients. A lot of crisis management just out the gate. There always seems to be something happening in healthcare. And so I really, honed my skills there, and then one of my clients took me in-house. It was a Catholic system that was going through a merger out in the Rocky Mountain area, and I ended up building their comms team, and then their marketing team, and then their digital team, and did that for quite a while, and have worked for a couple of other systems, and now I'm with Michigan Medicine, which is part of the University of Michigan, and I'm in charge of communications, marketing, and digital across the medical school, the research enterprise, and our clinical delivery system.
Wow, that's a big impact there.
It is.
So, the X number of decades we've been in this space, the concept or the issues in crisis management is something that's pervasive.
Yes.
And it seems like it's something that's not going away. Is that fair to say?
That is very fair to say. And it's almost, it'll be a constant. It's just, what are you managing? What topic are you managing and at what level?
And so for me, I don't have a background in communications or issues or crisis management, but there's a difference between issues and crisis. I'd love to, let's maybe first start talking about that. What are the differences here?
Yeah. It's interesting. Many crises turn into issues because they're long tail.
Okay.
When you think about a crisis, you might think about a plant explosion, and then really trying to manage that. Or Hurricane Katrina was the first crisis I worked on, and that had a lot of initial hard work and then sort of tapered off. So I think a lot of it is like how long does the issue last?
Okay.
And what do you need to say in that time? And is there danger to life, and facilities and things like that? Many of the issues we have now in healthcare are topical issues, payer disputes, the executive orders coming out of the government that higher ed needs to deal with, scandal, things like that. And so they may have a flurry of activity initially, but I really consider them issues management, because if they have a longer tail, then you're managing the issue for a longer time.
Yeah. I also think about when you talk about crisis management, it seems to be more reactive, but management to me implies there's strategy behind it, or there's some kind of framework, or how do you approach that?
Yes, it's so interesting. I used to do, when I was at the agency, crisis simulations, right? And you'd bring the executives in for a half day and sort of take them through what it would be like if media showed up at their doorstep, and ask them questions when they had incomplete information and what they should do and role play and all of that. And those things would just be put on a shelf and put away.
Yeah.
And they would rarely remember anything when the crisis actually happened. So there's sort of the training component you can prepare for, but it's really, I think, a framework of setting up an incident command structure. It's not just about communications and media relations. You need your leaders, your legal team, your operational leaders to all be in this sort of incident command structure. And healthcare is well versed in that, because a lot of times it has to do with facilities or diversions from other hospitals, of patients and things like that. We know how to handle it from a patient care standpoint.
Yeah.
What we rarely know how to handle, though, is from the thinking standpoint and the messaging standpoint across various constituencies. So I think it's really important. The first thing I always do is remain calm.
Oh, good.
That is probably the skill I have, and I've been told you have this incredible skill to calm the room down, because everybody's running around trying to figure out what to do, and just getting people organized and calm is probably one of the most important things a crisis counselor can do.
Yeah, I have been in these incident command rooms as a digital person because there's so many digital channels, which we'll get into in just a second.
Right.
But and I understand sort of that heightened energy, particularly when it's something so emergent.
Yes.
And so having that ability to kind of establish that peace helps.
Yes.
But because of the wide impact of a crisis and so many constituents involved, so many ways to outreach, having sort of a framework, I would say, would be helpful.
Right.
And so not having that understanding of what that framework is, how would you approach that?
Yeah. So I think once you figure out who's in incident command, you have to initially determine who are the approvers of any content or any communications that you're going to set out. You have to set up meetings, regular meeting schedules. I mean, when I dealt with the cyber outage at one of my systems, all of our business systems were down. So our email was down, Teams were down. We were using cell phones, and we had to get Google addresses and be off site and communicate in that way. So it's very important in the framework to set a cadence of meetings, who will be attending those meetings, who is your incident command lead. In other words, who's going to facilitate the meeting so it doesn't divert into what about this and what about that.
Yeah.
You have to be very focused to say what are the implications for the patient caregivers, what is the media asking for, and what can we provide, what will legal allow us to provide and say, what are our employees thinking, what are our physicians thinking, how are we addressing those. The interesting thing about both the hurricane situation and the cyber outage is we had to go analog.
Yeah.
And so I think one of the things that has stuck with me is who's our backup? If our website is down, and we can't send email, how are you getting messages out? So you need to create a framework whereby you say, what's our channel? Now you can use media as a channel. With Hurricane Katrina, we were using the radio stations to tell employees where to go to get their paychecks because the casino was destroyed.
Wow.
So you have to think through all of those things, and then you have to stick to the plan.
Yeah.
And make sure that it's just very well run and it's according to plan. And every day there's an update, and you get your inputs, and then you say, what are our outputs?
The regular updates is critical at those times.
Yes.
And as it seems inconvenient, right? I even had to spend like a weekend in a command center at one point. And I was like, I can't believe I have to leave my home. But it actually made more sense because of the very fact that you're talking about. Yeah. Now, I want to talk to you also about something else, which is, as a digital guy, I know that when an issue or a crisis, when a crisis occurs, really, that there are so many avenues now in which misinformation and outside public can actually start to form and maybe even influence how you respond to that, namely social media. And I know you're going to be talking about that at the conference. Tell me a little bit about how you approach social media in particular in this.
Well, and I'll say this is another key lesson and takeaway with crisis is you must manage expectations. Social media is a channel through which people communicate to one another. Sometimes it's accurate, sometimes it's inaccurate.
Right.
We can control some of the content on our own channels, but we cannot go into a Reddit thread and insert ourselves. That is actually a brand mistake and can, erode trust and integrity. So what we typically do is monitor those channels very closely and look for sentiment. It always amazes me that social media tends to self-police because for every criticism, there will be a citizen out there who brings the other point. And so we don't normally find having to insert ourselves in those conversations. Now, if facts are misrepresented, we will correct the facts. The other important point with digital channels is the website. So having a microsite or a place on your website that serves as the source of truth. And then letting everybody know what that URL is. And it helps people who are taking phone calls or getting questions, even internally, to say, you know what, for the latest, go to this website and you will find it. And then it's up to us to keep that continually updated, hear the feedback, sometimes from the social channels or elsewhere, and update that with what we're hearing in terms of themes.
Interesting. Turning it into a dynamic place that's a source of truth. I love that.
Yes.
I love that. Well, I know that we're never going to get rid of crises. We're never going to get rid of issues management. But it's really, encouraging to have people like you that have a good framework, have a good approach to this. And I know you're going to be speaking about it here at the conference. So I thank you so much for sitting down for a few minutes here and sharing some of your insights and thoughts.
Great to see you, Chris, as always.
Always.